Hello and welcome to the Passion Driven Pioneers interview series. I am your host, John Channon, and today I'm joined by Kris Bauerschmidt, who is the founder and co-owner of Prevailing Medical. Kris, thank you so much for joining us today.
Oh, thanks for having me. It's great to be here.
Yeah, I'm looking forward to our discussion. So would you mind just maybe kick us off with a brief background as to who you are, what you do, and the business that you're in?
Sure. So my name is Kris Bauerschmidt. I'm one of the founders. There's actually 6 owners and 6 founders of Prevailing Medical. So I am one of 6. So there's going to be lots of interesting things that come about because of 6. I really believe it's part of the success we've had.
Good.
So a little background. I started off in med device 14 years ago now, at a couple companies. And then I left my previous company in 2021. I joined with what was a garage business with one of the owners. We all invested in, and then kind of took it to the next level of being what I say, going from a garage to a legitimate, I wouldn't say legitimate, but a business where it was more legs to it.
So what was that initial spark that caused you to jump out of being with a medical device company and actually going into business and starting your own business?
Um, I so the company that I was at was a great company. I'd been there for 9.5 years. But it had just grown. It become about a $500 million company and become kind of corporate, in many respects, not in a bad way. It's just, I was used to working with doctors, kind of smaller groups, small businesses. And we just hit that point where we were working with very large entities. And really, they weren't as much working with the smaller companies. So, and that's kind of where my passion was, working with those smaller entrepreneurs, smaller businesses.
So talk to us a little bit about what Prevailing Medical does. My understanding is you guys do a little bit you help people with medical device designs and development, or am I a little bit off on that?
Pretty close. So we started off as a medical device contract developer. So when you first start off, we kind of limited our scope to be just development. And in this 3-year period, we've grown. Now we're in a 23,000 square foot facility with a clean room. And so we've added contract manufacturing. We mostly specialize in catheter-based medical device development and manufacture. And then we also sell some components, extruded tubing, shafts and sheaths, braiding. So some of these are just component level, but the rest is full design development, prototyping, contract manufacturing, and a clean room. So.
Okay, good. So talk to me about the change from kind of being in a business to running your own business, and what were some of the things that you guys focused on when you first got started in the garage?
Yeah, so actually the business had been called Prevailing Concepts, which was a garage business. So when we invested in, this is in October of 2021, and we had 6 owners. So with 6 owners, you're able to kind of divide and conquer, and really, each person kind of took an area. As in any business, you have to wear a lot of hats, but you still were able to just kind of, it allowed me to go out and meet as many people as I could, do kind of crazy different things to promote the business and let people know that you exist. So hopefully I answered that question.
Yeah. Maybe talk to us about what that first year was like. You mentioned having to wear a lot of different hats and things like that. How was that work-life balance? How much time did you guys really need to invest in this to get it up and get it going to where it is today?
Well, we invested just from our own pockets, so we didn't take any other money really from any investors. And it was, I'll tell the story of not getting paid for 7 months. So when you do something like this, you're kind of making a commitment to, and you understand that you'll be either paid much lower than you might have been in the past, or you start off with really bootstrapping. And other businesses may have started off with a lot of investment funding or something like that. It could be very different. But for us, it was really bootstrapping, really trying to do everything like setting up insurance, setting up the lease, leasing a building, getting equipment, just a whole myriad of tasks, building websites. Most of these things we did or we built. Sometimes we built some of our own equipment. Often we did a lot with less, is what I would say.
So you mentioned you were kind of a contract developer to start with, and now you're doing a little bit of contract manufacturing. Talk us through what that decision process was like. As you said, there's six of you as co-founders. What led you to want to get into the contract manufacturing aspects of this?
So this is really just related to the area that we're in. So in medical device, when a customer comes to you, they kind of expect you to be able to develop the product and then take it all the way to commercialization. So you need that ability to, like if you're going to build clinical units, most of these things need to be done in a clean room.
Mm-hmm.
You can do all of your early stage work without a clean room. You can do all the benchtop stuff. But at some point, you're going to hit that point where you're going to need to build, sterilize, a product in a clean environment that, we have a class 7 clean room now. So you're going to be able to need to do that to go first in human and, all these things, all this testing that you have to do. So it was just a necessity for us. But in the beginning, there's a lot of cost, in terms of building out all that infrastructure. It's not something that you can just do, without a lot of funding. So we built it, kind of in stages. We followed a plan. We had a plan. We always knew we'd have a clean room, but we just went in stages because the customers that we were getting in the beginning didn't need one at that point, and now they do. So it was more about what our customers needed more than, were we ready for it? We were, but we knew our customers needed it. So.
Mm-hmm. Okay. So you mentioned you guys have a focus on catheters, I believe you mentioned earlier. What are you guys doing, or how are you staying like adaptable, open to change, and innovative in that industry? Because catheters, have been around for a long time.
Yeah, so I mean, it's an area that we know well. We have a lot of specialized equipment for it. So we're doing advanced catheters. So when I talk about catheters, people's view, the one person might be thinking urinary catheters and things like that. Typically, the kind of work we do is an advanced catheter. So it's like a valve, like delivering a new heart valve, neurovascular catheters for treatment of stroke, opening up vessels, electrophysiology catheters, which map out the heart and ablate tissue, would be hooked up to a generator and deliver RF energy, or cryo catheters. So we're doing that kind of work. A lot of peripheral lithotripsy devices, just kind of the leading edge type stuff and very complicated stuff. These catheters are about 95% of most of the catheters that we do would be PTFE lined, braided and coiled, steerable often, quad steering. Some of them have small cameras built in, pressure sensors, other high-tech stuff. So again, I don't know if that answered it, but staying current, we're kind of experts in this. This is what we did prior to this. And we've just, I think when people start businesses, sometimes they go, oh, this is a cool new thing. We're a business that's just like, let's say, an auto mechanic. People have been fixing cars forever. People have been building catheters for a while. It takes a lot of specialized skills, and we just did what we knew. So we focused on our skills.
And so you focused on some of the things that you guys were really good at, right? But how are you getting ideas for kind of the next generation of products or the next changes that you're doing?
So we follow along with the industry trends. Right now, there's a lot of work in robotics. So if you ask me for hot areas, valve delivery systems are still fairly hot. Electrophysiologies, there's been a lot of advances. things like the Ferropulse catheter, things that are doing, just different things that are out there that we're fully aware of. The lithotripsy devices, that's kind of a leading edge technology. So these are areas that we've been aware of, but they really become the hot area. Um, so we stay abreast of that, but usually what's happening to us is our customers are coming to us with a drawing or with a device or with an idea. And especially since we're working with so many like startups and early stage companies, they're on the forefront of technology. And then what they're doing is coming to us and saying, okay, how do I do this? I want this. And so sometimes we're literally whiteboarding and coming
Mhm.
up with those ideas and coming up with new technologies and new ideas in areas. It's a constant in med device. It's a constant state of improvement. You're constantly trying to do something new or novel, or even if you're doing a Me Too device, you're still trying to innovate some aspect of that device. So hopefully I answered that question.
Yeah, and Minnesota is a hotbed of activity in the medical device area. And why do you think that is? Because we moved here, I was unaware of all the medical device companies that were actually located here and startups, and I'm constantly amazed by how many there are.
Yeah, there's several reasons for this. So if first off, Minnesota is the second leading med device area in the country. So typically most people will go California, Minnesota, Boston, and then there's Houston, Austin, um, the Raleigh area. There's just all these other little kind of hubs and spokes that have been interconnected. But Minnesota, I think it's because of Medtronic, because of the University of Minnesota, and the Mayo Clinic. Those three things together have kind of created an ecosystem of med device. And then what you find is we're the exact epitome of this. What happens is a good example is Boston. I'll go to Boston, and there's a lot of needle manufacturers in that area. There's a lot of catheter people in our area. So what happens is people start working in an area, and then they spin off like us. We form a new company, but we know med device, so that's what we work in. So you suddenly get these companies that just kind of cluster, and then that cluster becomes a bigger cluster as companies spin off. And you have so many headquarters: Boston Sci, you have St. Jude, there's facilities for all these: Boston, Olympus, Medtronic. The list goes on and on of med device companies in this area.
Yeah, it's a good business to be in here in Minnesota for sure.
Yeah, it is.
So I'm gonna change subjects a little bit on you, ask you the magic wand question, right? And so you've been doing this now a couple of years. If you could wave a magic wand, right, and just change one thing about your business, what would that be?
Wow, that's an interesting question. Boy, I mean, I don't want to make this sound like that we knew everything and that we didn't make mistakes. Certainly, sometimes we bought something that was the wrong thing, or we've made a bad purchase here or a bad purchase there, and we would go back and undo those things. But overall, you know, I think we've done fairly well. I don't know if I mean, I hate to say it. I know that you're looking for an answer here, but I don't know if I would change a lot other than, some of the mistakes that we've made, mainly with a purchase or two, where you might waste 10 grand, let's say, and you're like, especially when you're starting out, you're like, oh, that's painful. But there's not too much of that. So not a lot I would change, really. I
Okay,
think the 6 owners, all these things have been kind of progressively helped us.
good, good. Now let's talk a little bit more about the future. Would you mind offering us a glimpse into your future plans and goals that you have for your business?
Yeah, for us, when we first started, we had a little 3,500 square foot facility, mostly warehouse. I shared an office. Like we had one room with 3 desks in it, which was the office. We had one conference room, kind of a front area, and then all of the rest was devoted to warehouse and actually doing development work in that area. Little tiny place. So our big goal was actually where we're just at right now. On May 1st, we moved into a 23,000 square foot facility, and then we put in a clean room. So we've literally just completed the clean room. We get testing this week, and so we'll be ready to manufacture product pretty much next week. So this is kind of the next evolution for us, is to go to this. We've kind of already done it, where it's kind of a state-of-the-art facility. Again, you get kind of lucky in that area too. We did a sublease, and it was a building that had about a $5 million build out done to it prior to us. So, not something a smaller company could do, but you do a lot of, when you're small businesses, you have to be very nimble, and you have to be inventive, and you have to be creative, in terms of, trying to do all the things that you want to do. But that's our next stage right now. So the question is, what's the future hold? We'll continue to grow as we gain more customers, we continue to just add more capabilities. We keep little businesses, they put everything back into the business, and that's what we've done. So we'll just keep going on that path. But this was a pretty eventful year for us.
Yeah, it sounds like it. It sounds like you're ready to get that clean room up and going here pretty soon. So that's great.
That's all sad. I've been posting in LinkedIn pictures of it. It's very cool for us to have this, knowing where we started, in 2021.
So knowing that this show, right, is targeted towards people who are going to be starting up a business, or maybe in their first couple of years worth of business, do you have any final thoughts or words of advice you'd like to share with our audience today?
Sure. I think the real big success is, and there's challenges with it, to having multiple owners. There's definitely some people, I don't know that many companies that have 6 owners to just start off I'm sure you've met with lots of people and talked to lots of groups that have started companies, and you'll see the solopreneur or maybe partners or things like that. 6 owners is very different, but that has been, in my mind, probably one of the key ingredients to our success. Because when you start off as a business, you're limited financially, you're limited in so many areas, and hiring people is a big, even a big challenge, and to try to find the right person. But when you get 5 other individuals together with yourself, you can divide and conquer. You can have one person that's out there trying to sell and create business. You got another one that's setting up things. You got another one that's building equipment. You got another one that's doing engineering, and we have one that's doing all of the administrative tasks. So we were able, because of having multiple owners, we were able to be a much bigger company than our footprint. And also, your owners are dedicated. Your employees are too. But when you have, as you know, passion-driven pioneers is the name of your show. You're passion-driven when you're an owner. And so you're driven to, just, if you take one owner and you multiply them, by 6, you can see how much more you can accomplish with 6 owners than you could with one. So that's one of the secrets of success.
Yeah,
so.
you are indeed unique with 6 owners. That's the first time I've had anybody with that many. I've had 3 owners before,
Okay.
but never more than 3. So this is it's unique, but I think it's all dependent on the business that you're going to be in and the expertise that you need. And can you find that many people that would be committed to the same type of vision and passion that you guys have? And it sounds like you really have. So congratulations on that.
Yeah, I know we wouldn't be here without all the other 5 owners. So it's strange to be in front of you just as myself when I think of all those other owners. And then a lot of the other suggestion I would have is a little bit of out of the box thinking. So, just being nimble, being able to do things. For me personally, one of the things that I did, a year and a half ago at this point, actually 14 months, it's not even that long, was I formed a networking group. And when you first started the business, when you're unpaid, sitting in an office, and you go, okay, I need to get out there as much as possible to let the world know that you exist. I mean, quite literally, that's what my first thought was. How do I let the world know that I exist, that this company exists, that we're here to, we have services, we're trying to, run this business. And so one of the things I did was form a networking group. So here we are, 14, like these are unusual things for people to do, but we have 1,400 members of that networking group now, close friends. And you think it's for business. It's not necessarily for sales. It's because, suddenly you're talking and meeting and connecting with so many, and that networking is so important to a small business. So anyway, so I formed a networking group. It's 1,400 people, and we now, we get about 100 and something people per event that come out. And that's a lot of work. Again, with 6 owners, you could do something like that. With 1 owner, they're too busy to do something like that. So, but again, little things out of the box. So find ways to separate, differentiate yourself, and let the world know that you exist as a new startup founder.
Well, I appreciate your sharing that. So thank you so much for your time today, Kris.
Yeah, thank you. You have a great day. Thanks.
Thank
Great
you.
talk.
Great meeting you and learning more about your entrepreneurial journey. And to everyone watching, I look forward to seeing you in our next episode.